Good afternoon, whenever you may be watching this video. Hi, my name is Brianna Foster, and I am a psychiatric nurse practitioner. I am a master's degree prepared nurse practitioner specializing in psychiatry and mental health. I'm also the owner and operator of Novi Concierge Mental Health and Medication Management. And today I'm going to be giving a very informative talk about what medication management is, with the goal of helping you as therapists feel more comfortable with recommending medication management for your clients who you're feeling might need a little extra support. They're responding to the therapy, but their symptoms are still very distressing. And so, my goal is to help you feel more comfortable with recommending medication management for the clients who may benefit from these types of services. Just a quick welcome and introduction. My name, once again, is Brianna Foster. I am a master's degree prepared psychiatric nurse practitioner, and I'm also board certified by the ANCC. I have over 15 years of experience in mental health, particularly ranging from multiple settings, inpatient care. I worked at the University of Michigan for over 10 years. I also have experience in community mental health, seeing a range from children all the way up to elderly, older adults, and then also in the outpatient private practice specialty as well. And I am the owner and operator of Novi Concierge Mental Health and Medication Management. And I'm very passionate about partnering with therapists and other providers to collaborate to ensure that our clients are getting the most comprehensive and holistic care. Because what our therapists do is so important. And so I think it's very, very vital that we start to establish a relationship to where we can feel comfortable with coming to each other and collaborating more often for the sake of improving the quality of care for our clients. So let's get started. Exactly what is medication management? So, medication management is a structured clinical approach to assess symptoms plus determine if medication can help. It includes diagnosis, prescribing, dose adjustments, monitoring, and ongoing follow up. So, during an initial assessment for a client who might be getting worked up for medication management, the provider is going to thoroughly and comprehensively go over all of the client's symptoms, their current symptoms, the severity of them, as well as their medical background, their psychiatric background and history, and any medications that they also are currently taking. And then, based off the assessment and the severity of the client's symptoms and the amount of distress as well that these symptoms are causing the client, the provider may decide to prescribe a medication based off of the assessment. And then the client will then come back with usually about between 3 to 4 weeks, sometimes as many weeks as 6 weeks, depending on the situation and the client. But the client will come back, and based off their response, there may be an adjustment made to the dosage, or the medication may be discontinued depending on their response. It just all depends, but the key is that the client will be monitored on an ongoing basis from then on to continue to manage that medication. And so essentially, that's the process of medication management. The client continues to come back on an ongoing basis for follow up care. And a collaborative approach with the therapist to support the overall mental health treatment is vital. And so I think that therapists and nurse practitioners and medical doctors really do need to work on helping to get that collateral information from the therapist to the provider so that way we can have a more accurate and a more comprehensive idea of how the client is responding to the medications. The goal of medication management is to reduce the symptoms and to improve functioning. We want our clients to be able to be the person that they would like to be without being held back so severely by their mental health symptoms. We want their function overall to improve so that they're living a life and functioning in society to the best of their current ability. And also to improve therapy outcomes because we know that when symptoms have improved, the client will be able to not only function better, but also to get more out of their therapy sessions as well. Now, let's talk a little bit about what medication management is not. Medication management is not a quick fix or a one time appointment. As we previously discussed, medication management is actually an ongoing process to where the client will come back as often as needed in order to adequately assess and make adjustments if needed based off their response to the medication overall. It's not a replacement for therapy. In fact, evidence shows that clients who have therapy plus medication management together have the best outcome for recovery because therapy is also addressing the psychology and how the client is looking at things and their unhealthy behaviors and their unhealthy thought processes, while medication management is addressing the biochemical imbalances and the physical health issues that may be contributing to their mental health. And so, with the therapy on board plus the medication management, clients who have both of those modalities in their treatment plan have the biggest and greatest chance of experiencing recovery and mitigating their mental health symptoms overall. It's not about medication management, it's not about over medicating, but instead of a targeted evidence based treatment. All of the treatments that I recommend for my clients are based off evidence and it's based off of the studies and things um, that have been shown to help with the symptoms based off of the evidence we have currently today and what we know that tends to work best for whatever the client's experiencing when it comes to their symptoms, let it be depression or anxiety. It's all based off of evidence. And it's most definitely medication management is not rushed, but it involves careful monitoring of the client's progress and it's an ongoing process as well. So, when might a client benefit from medication management? When you start to notice that the symptoms are not improving with therapy alone and their function becomes impaired. So that could look like clients who are having difficulties with getting out of bed in the morning, who are having difficulties with maintaining their ADLs, whether that be taking a shower, brushing their teeth, their symptoms, their depression, their mood, their anxiety is so severe that they're not able to function to a level to where we would expect for them to. Their symptoms are very persistent despite the therapy, what you've been working with them for several months is still very intense and you're not noticing really much of an improvement. And then also, you're noticing more distress, whether that be irritability, whether that be avoiding the things that, may be triggering their symptoms despite consistent therapy. That also could look like suicidal ideations, passive, especially with active, and that starts to become more of a safety concern. And so clients who are consistently having these very intense symptoms may be a very good candidate for medication management. And as their therapist, you all are in such a powerful place in all of the important work that you do. If you are seeing that they are at a stuck point, regardless of all of the therapy work that they've been consistent with, they may be a good candidate to get that extra support from medication management to helps them to get unstuck in the place where they're currently at with their symptoms. So, what are some of the common concerns that medications can help with? Medications can help with a variety of different mental health disorders, but some of the common ones that we usually address are depression. So that looks like a low mood, anhedonia, a persistent low mood, a lack of wanting to do the things that once brought the client joy, that fatigue, that low energy, that despite all of the other, holistic things that we've been addressing, whether that be exercising, improving their diet, they're still so fatigued and feeling hopeless to the point to where they are starting to have those persistent suicidal ideations, whether that be passive or active. Anxiety is very common in our society nowadays, and anxiety, that may look like racing thoughts. Um, Clients are having a hard time with settling down because their thoughts are just so fast all of the time. That could be physical tension, especially in the shoulders, the lower back. A lot of clients will complain of headaches because of the amount of stress and anxiety that they are carrying. But anxiety at its core really is excessive worrying, worrying about different things, worrying too much, and not being able to control the amount of worry. Another very common disorder is ADHD. So, not being able to focus, not being able to pay attention, not being able to follow through with the things that need to be done, disorganization, being very impulsive. ADHD, however, does require extra testing. So, all of our clients who are undergoing medication management for ADHD will first require a neuropsychological evaluation. And after they've been diagnosed with ADHD based off of the neuropsych evaluation, then medication management can commence. Also, mood disorders that could be unipolar depression or bipolar depression. But one of the hallmarks of both depression and bipolar disorder are irritability, mood swings, particularly in bipolar disorder, if that be bipolar 1 or 2, and then also impulsivity. And so that's just speaking to that. The impulsivity commonly seen in ADHD and bipolar disorder, it's so important to have that distinguished. And that's why I believe a neuropsychological evaluation is required and should be done. That's the best practice and that's the best standard of care. And sleep issues are the clients that you're working with struggling with sleep. And as we know, our sleep is so fundamental and foundational to our overall mental health as well as our physical health. So, are they struggling with getting restful sleep at night? Medication management can also help to address these concerns as well. So let's talk about what are some of the clues that a client might need medication support. So, from a therapist perspective, what you all might notice is that the progress from the therapy is either stalling or is either regressing. So, you all were making great progress before, but that progress is no longer moving forward. Instead, they're either stalling or regressing altogether. The client themselves may also report that they're feeling melancholy, they're feeling flat and emotionally stuck. Despite the therapy, despite them being consistent, they're just continuing just in that same emotional depression or feeling just like they're not moving forward. The long-standing symptoms that are starting to interfere with their daily functioning. This is a major one. If you're noticing that your client is still having an issue with getting out of bed in the morning, are they struggling with showering? Are they struggling with keeping up with the things at work that they need to in order to continue to support themselves and their families? That's a huge indication that they may need extra support with medication management. Another big one is, are they feeling emotionally overwhelmed? Are their emotions so intense to where it's starting to interfere with their daily functioning? Are they not thinking from a place of logic where their prefrontal cortex lives, or are they living in emotions? Are they acting out of fear from where the amygdala is in our brain, that core area? are they not functioning? Are they not able to think things through logically because their emotions are so overwhelming and difficult to regulate? The next clue, are they requiring consistent crisis management? Are you having to, remind them of the, emergency plan? Are they calling 911 consistently, having visits to the emergency room very consistently, ongoing? That is a clue that they may need a little extra support with medication management. And then finally, are they having difficulty with concentrating enough to even engage during therapy because they are just so caught up in their symptoms? They're not even being able to benefit from the care that you're providing. That too is also a clue that a client might be able to benefit from medication management. So, what are some of the common medications that we will commonly prescribe in psychiatry and how do they work? SSRIs are our most common antidepressant. SSRI stands for selective serotonin reuptake inhibitors. And some examples of SSRIs are Zoloft, Lexapro, Prozac, and Celexa. And the way that they work is by increasing the serotonin availability in our brain. And so we use SSRIs to treat depression, anxiety, PTSD, OCD. And essentially, what they're doing is they are helping to balance out the serotonin levels in our clients' brains who might be suffering from anxiety and depression. And often, what they will notice is that their anxiety symptoms are not as severe as they were before starting medications, or that their depression symptoms are dramatically improving, or at least starting to improve after starting an SSRI. ADHD medications are also very common, such as Adderall, Ritalin, and Vyvanse. And the way that these medications work is they also work to balance out the neurochemical imbalances, specifically with our dopamine levels. There's also non-stimulants as well, that work a little bit differently than stimulants, but that are also too very effective, such as Strattera, Quilbri, and Guanfacine. And the overall goal for us when we are working with clients to help address their ADHD core symptoms is to improve their focus, to improve their impulse control, and overall organization skills. Next, I just wanted to share some real success stories that I've noticed and that I've witnessed in my practice where clients in therapy who have been working and engaging in therapy for several years finally started noticing relief in their depression after adding a medication. Also, individuals going through very melancholy moods who were withdrawn after starting medication started to become more engaged and motivated. Their sadness started to lift quite a bit. I've worked with teens also who have ADHD and were going from poor grades to being at risk for failing their current grade because they weren't able to keep up with the assignments, they weren't able to follow through, or even having that hyperactivity symptom to where they weren't even able to function in school. To after starting a medication for their ADHD, they became more confident, which caused them to be more successful, more organized. And then adults also with anxieties who were not able to even concentrate on their everyday functioning because their thoughts were racing so quickly. But after starting a medication, the anxiety levels started to become less intense and they were able to better participate in therapy and to better function overall and just felt better overall. And then also, medication can also help break through those emotional barriers that you all are working with your clients. Medication can also help the client to work a little bit deeper with you all during your sessions because their symptoms are better controlled. So, how do we as psychiatric providers collaborate with therapists, and why is it so important? Communicating about shared clients is vital because of the important work that you all do as therapists. You will most definitely have a different insight to your clients than what a psychiatric provider will, because you all are going to be more than likely spending more time with the clients, and they may be opening up to you about different aspects of their lives and their mental health and their symptoms that really don't come up naturally, or whatever the rapport might be with their psychiatric provider. And so having that clear communication between the therapist and the psychiatric provider is vital. Also, we know that medication plus therapy give clients the best outcome to recovery and success. There's been many studies and much evidence to support this. And so, as providers, we want to give our clients the best chance of being successful, the best chance of having a positive outcome. And we know that medication and therapy together, both of them, are what's going to give our clients that best chance of recovery. As therapists, what you all do is so important. You all are providing that behavioral insight. You all are really getting down to the core symptoms and the causes as well, from a behavioral standpoint, of what could be exacerbating our clients' mental health symptoms. And I, as the psychiatric provider, I provide clinical adjustments and clinical insight from a medical perspective, a biochemical perspective. And when we bring our insights together, it really does help us to care for the clients from a more holistic and comprehensive way. Clients are always encouraged to stay in therapy. Therapy is the other aspect of the care that's so important. As we just mentioned, therapy and medication together is what's going to cause that best chance for a positive outcome for our clients when it comes to their mental health recovery and helping to best manage their symptoms. And my goal as a psychiatric provider is to support my clients the best way possible, and by also supporting your work as a therapist, not to replace what you do, but for us to work collaboratively together to give our clients the best outcome possible. So, how do you refer a client for medication management? At Novi Concierge Mental Health and Medication Management, we are accepting clients for ADHD, depression, anxiety, mood disorders, and a host of other mental health concerns. We see clients throughout the lifespan, from adults, teens, and children. And if you would like to reach us directly or share our phone number with your client to reach us, our phone number is 248-916-0348. Also, please share our website with your clients and visit our website as well if you would like to learn even more about our practice. Our website's www.novipsychiatry.com. And also, too, if you would like to reach me directly to maybe talk a little bit more via writing about a potential referral, just to see if it may be an appropriate referral for our practice, you can reach me at support@novipsychiatry.com. Referrals are very easy. You can do a referral via email, a call, or even the client can also call us directly as well. We have same week appointments available because we prioritize helping our clients to get the care that they need quickly without having to endure a long wait list. And in closing, I just want to say thank you for the work that you do to support our clients' mental health every day. A reminder too that medication management works best when paired with the important work that you all are already doing, which is the thoughtful and consistent therapy that you are providing for your clients. Also, collaborating allows us to reduce the suffering and also to improve the long-term outcomes for our clients' mental health. And also, I appreciate and I am very thankful for the opportunity to potentially collaborate with you in regards to your client's mental health care. Thanks again and take care.